What's up, everybody? This is Rich from True Budget EDC and Prepping. You use your gear or lose your gear, because if you're not using it, you might as well lose it. So just wanted to come on here real quick and do a quick video of things to put in a trauma kit slash, Alice kit slash active shooter kit, stuff like that. Always remember, you can put anything you want in your bag. If you're not trained, you're not going to be able to use it properly, and that's not going to help you. So the most important thing before you decide to put stuff together is to get trained on first aid, on stop the bleed, on what to do and when to do it, and then you can go from there. So before I start the few things that I have out here, I just want to go over the fact that I have a 200 sub giveaway going on still. I haven't really mentioned it lately, but if you go back through my videos and look for the video, it says it right on a 200 sub video. When I reach 200 subs, I'm going to be giving away a knife, a Rough Rider Highlander equal end knife, and super cool knife, slip joint, really awesome. So go back, check out that video, comment on it, comment anything you want. You comment more than once, I don't really care. I'm just only going to enter you once. So once you do that, you will be entered. So good luck to all the people that already commented, and good luck to the people that will comment in the future. At like 172, so we're getting there, about 28 more people, and that giveaway will be in full effect. So I want to come on here and do this because I've seen a lot of people putting out videos for first aid kits, trauma kits, stuff like that, active shooter kits. So there's a few things that you need. First of all, always buy a real cat tourniquet. Don't buy a false one. Don't buy a fake one. Don't buy one for $5 online. They fail. Sam Slishman is a doctor that works with Rescue Essentials, and he had his son, well, he's like 7 years old, apply a fake cat to his arm, and it broke. So a 7-year-old can break a fake cat. So if you're putting a fake cat in your kit, you're not helping nobody, because you can do more damage than good. You go to put on a tourniquet that you think works, and it breaks, and the person bleeds to death because you didn't have the proper equipment. So never use a fake cat, never use a fake soft tee, never use a fake anything. Use a name brand. They're put together. They cost $30. It's not $1 million. I mean, you're saving a few bucks on a cheap, knockoff, but you're also risking somebody's life or your own. So always buy a real tourniquet. So this is a soft T Gen 4. So this is name brand. I just happen to use the soft TW because I like it. This is Tactical Medical Solutions. It has a metal clip on it, so if you want to, put it around a limb that's pinned, you can just unclip it. You don't have to really unbuckle it and re-thread it or none of that crap. You just pull the metal clip off, snap it back on. After you put it around the leg, it's good to go. So these are the things you should always have in your trauma kit or stop the bleed kit, or basically just a shooter kit for GSWs. Should always have chest seals, right? To prevent pneumothorax or tension pneumothorax, so which is a collapsed lung. So North American Rescue, H&H Medical, they all have chest seals. So get yourself chest seals. Make sure you get 2, because there are 2 wounds, entrance and exit. So you have to seal both of those to prevent air getting into the pleural space. So get some chest seals. You need that for sure. You're going to need some kind of bleeding control. So it's really good to get yourself a, just right here, we got an Israeli bandage. This is a 6-inch. I'd suggest getting a 6-inch. I have multiple, but the 6-inch is the one that's most versatile, and you can use in pretty much any situation. So get yourself a compression bandage. There's tons of them on the market. That's just the Israeli. I have a whole bunch of them. H&H Medical, H bandages. I have just a ton of them. So, but that's a good one to go with. Also, like I said, get yourself a windlass tourniquet that's a name brand. Don't get a knockoff. This is a soft T. Get yourself either this or a cat or something, but get something that's real, something that's not fake. The only reason I have this wrapped is just so it doesn't get dirty. It's not, it's not sterile. It's just so I keep it clean. So that is my soft TW Gen 4. Also, you're going to need some compressed gauze to plug the wound. So if there's a gunshot wound or a hole, like I like calling it plugging holes, you're going to have to stuff it full of gauze and then put the compression bandage on it, or pack it full of gauze and then apply a tourniquet, but you're going to have to do that. So there's 3 things you need to do for bleeding: apply pressure, apply a tourniquet, and plug the hole. So that's why you're going to need that compressed gauze. And then you should always have airway management. just to have it because you never know. And a trauma kit, not necessarily for an active shooter kit or a stop the bleed kit, but should have airway management. That's an NPA. Also remember to get some of the gel, the Vaseline, so you're not just jamming a rubber hose up somebody's nose. You got some gel to, you know, help them out. It'll go up there easier. And they should always have a decent pair of trauma shears. I have X shears. So these are the things that you should have in your trauma kit at the bare minimum, or your active shooter kit at the bare minimum. And I'm just coming on here to put this on here because I see a lot of people, you know, buying fake stuff and stuff that's going to fail on them. And I'd rather put this video out here so that they can get rid of that junk and go buy some like real stuff. Like I said, soft TW for 30 bucks. Cat from NAR, 30 bucks. It's not like you're spending $1 million. And do not use your tourniquet as a practice tourniquet. You're supposed to buy a tourniquet and use it once, and that's it. You get one use out of it. Hopefully you never have to use it, but if you do, use it on the person you have to use it on, and then it's gone. If you keep using it over and over again, you're going to weaken it and it's going to fail. So there really is a good reason to buy fake tourniquets just for practice, because otherwise they're crap and they're going to fail. But if you're using them for practice, that's fine. So this is what you should have at a bare minimum. I am a first responder, a EMR/EFR, which are basically the same thing. Emergency medical responder, emergency medical services first responder. I'm in behavioral nursing. I'm also a camp nurse, and I'm a volunteer firefighter. So I'm an EMS, fire, nursing. You know, I'm all about the medical and all about what should be used and what shouldn't be used. I'm a CERT coordinator, so also teach classes out of that. I'm a first aid instructor and a registered stop the bleed instructor. So you know what I'm saying? Just use the right stuff, carry the right stuff. Don't buy crap because it's going to fail on you and somebody's going to die. And at the bare minimum, get yourself a chest seal, a compression bandage, a windlass tourniquet, compressed gauze, airway management, and a decent pair of trauma shears. All right, hope this helps. You guys have a good one.